Osteomyelitis, a clinical overview. Exploring the causes, symptoms, diagnosis, and treatment of bone infections to empower healthcare professionals with essential knowledge. What is osteomyelitis? Osteomyelitis is a severe infection of the bone marrow, and surrounding soft tissue, primarily caused by bacteria. This debilitating condition can affect any bone in the body, but it most commonly impacts the long bones of the legs and arms, as well as the vertebrae and pelvis. Understanding its definition is the first step towards effective diagnosis and management, as the infection can lead to significant morbidity if not addressed promptly. Understanding the roots, causes of osteomyelitis. Osteomyelitis can arise from various pathways, each presenting unique challenges in prevention and treatment. Identifying the source is critical for targeted intervention. Bacterial infection. Most commonly caused by Staphylococcus aureus, though other bacteria like streptococcus and Pseudomonas are also significant pathogens. Trauma or injury. Open fractures, deep penetrating wounds, or soft tissue injuries can directly introduce bacteria into the bone. Hematogenous spread. Bacteria can travel through the bloodstream from distant infection sites, reaching and colonizing bone tissue. Predisposing factors, surgical and circulatory risks. Surgical infection. Contamination during orthopedic surgery, such as joint replacement or internal fixation, can directly lead to post-surgical osteomyelitis. Poor circulation. Conditions like diabetes mellitus, peripheral artery disease, or chronic venous insufficiency impair blood flow, making bones more vulnerable to infection and hindering healing. Recognizing the telltale/indicating signs, clinical presentation. The symptoms of osteomyelitis can vary based on the infection's location and severity, but key indicators often guide initial suspicion. Persistent pain. Severe, localized pain in the affected bone, often worsening with movement or pressure. Swelling and redness. Inflammation, warmth, and erythema, redness, around the infected area. Systemic fever. High fever, chills, and profuse sweating, indicating a systemic inflammatory response. Limited mobility. Reduced range of motion or stiffness in the limb or joint adjacent to the infected bone due to pain and inflammation. Pus drainage. Formation of sinus tracts leading to purulent discharge or pus from the affected area, especially in chronic cases. General malaise. Generalized feeling of being unwell, including fatigue, lethargy, and loss of appetite, reflecting the body's battle with infection. Precision diagnostics, initial assessment. Accurate diagnosis is paramount for effective management of osteomyelitis. A multi-pronged approach combining clinical evaluation and advanced imaging is typically employed. Medical history review. Thorough assessment of patient's medical history, current symptoms, and relevant risk factors for bone infection. Physical examination. Careful examination of the affected area for localized tenderness, swelling, warmth, redness, and any signs of open wounds or drainage. Imaging studies. Initial imaging with X-rays, followed by more sensitive techniques like CT scans, MRI, or bone scans to visualize bone changes and detect infection. Confirmation and causative agents, advanced diagnostics. Blood tests. Blood cultures help identify the causative bacteria, while inflammatory markers, ESR, CRP, monitor infection severity. Bone biopsy. Considered the gold standard, a bone biopsy or aspiration obtains a sample for culture and histopathological examination to confirm diagnosis and identify the specific pathogen. Blood cultures can identify systemic infection. Strategic management, treatment approaches. Effective treatment for osteomyelitis is often multifaceted, combining aggressive antimicrobial therapy with surgical interventions when necessary. Long-term antibiotics. Intravenous and oral antibiotic therapy, often for 4 to 6 weeks or longer, tailored to the specific pathogen identified. Surgical intervention. Debridement, removal of necrotic bone and tissue, and drainage of abscesses are often required to control the infection and promote healing. Pain management. Analgesics and other pain relief medications are crucial to manage severe pain and discomfort throughout the treatment course. Immobilization. Immobilization of the affected limb or joint using casts or splints can reduce pain, prevent further injury, and support healing. Proactive measures, prevention and control. Proper wound care. Prompt and meticulous treatment of all wounds, especially open fractures, to prevent bacterial entry. Strict infection control. Adherence to rigorous infection control protocols in all healthcare settings to minimize nosocomial infections. Good hygiene. Maintaining excellent personal hygiene and wound care practices, particularly for individuals at high risk. Prompt medical attention. Seeking immediate medical evaluation if any symptoms of infection, especially bone pain or fever, occur. Early diagnosis and aggressive treatment are crucial to prevent long-term complications, preserve bone function, and ensure effective management of osteomyelitis.